Hello, my name is Chrissy, and for my final project, I decided to discuss simulating telehealth to improve communication skills among nursing students. In March of 2020, the world was thrown into a whirlwind of changes caused by the COVID-19 pandemic. One of these changes was the rapid shift to e-learning. A prime example of this was PA College's shift to Zoom-hosted virtual classes for pre-licensure students. Since the onset of the pandemic, telehealth has become more prevalent as healthcare workers attempt to meet the social distancing standards set forth by the CDC. The issue that I have noted is that PA College lacks a telehealth simulation for pre-licensure nursing students. My proposed solution is to implement telehealth simulations that utilize motivational interviewing to improve nursing student communication skills and prepare them for potential post-COVID reality. So the research that inspired this project is as follows. Research has shown that the rapid shift to e-learning that occurred in the beginning of the pandemic has increased nursing student anxiety overall. Research has also shown that simulated patients help nursing students develop their communication skills, as reflection and correction can occur in a safe, controlled environment. In addition to its rapid growth last year, as well as its exponential growth in the past decade, nursing curriculum should include simulations about telehealth. Telehealth situations and simulations have increased student confidence in their communication skills, and research has shown that simulations should include motivational interviewing to create a conversational, patient-centered experience. The stakeholders involved in this project include students, faculty, and administration. Students are directly affected by this as they are the ones that will have to participate in the simulations. Faculty is also directly involved as they are the ones that are going to have to write up the simulations and conduct the simulations. Administration is kind of on the back burner at this point, where they have very high interest in this, as it could be a selling point for the college if it takes off and does well. As for reactions, I think the students might be a little wary about the project at first, but I feel they'll warm up to the idea once they have a simulation or two in their back pocket. As for faculty and administration, I feel that they're going to be willing to try my solution out, as they are always looking for ways to improve the education that the college provides. I do feel that they will want to monitor student experiences, maybe through a survey or end of the semester evaluations, to decide whether or not that they want to continue the simulations that I have laid out. As for cultural considerations, it is going to be very important to remember that different students have different cultural beliefs, and different cultures have different standards of what good communication is. Examples would include eye contact and body language. To address this cultural consideration, I suggest having briefing sessions, which will be held before the simulation, that can lay out the expectations for the simulation, what is going to be expected of the students, as well as address any of the concerns that the students may have regarding the communication. So my 60-second elevator pitch is as follows. COVID-19 has thrown the world for a loop, especially in the realm of healthcare. Telehealth has become the new norm, and education in healthcare needs to reflect that. Student anxiety is extremely high, partially due to the lack of face-to-face clinical experiences that allow students to practice their communication skills. Research has shown that telehealth simulations improve student confidence in their communication skills and should be included in nursing curriculum. The simulations should utilize motivational interviewing as a method to create a conversational, patient-centered experience. Conducting telehealth simulations at PA College would allow students to practice their communication skills in a safe, controlled environment that allows for reflection and correction if need be. I feel that implementing this solution will benefit the students, allowing for the next generation of nurses to be well-rounded in their communication skills in a post-pandemic world. And finally, here are my references. Thank you all so much for taking the time to view this presentation.